Much, Dr. Nunez-Smith. Good afternoon. Let's begin with an overview of the data. Our 7-day average of cases is about 95,000 per day. The 7-day average of hospital admissions is approximately 8,500 per day. And the 7-day average of daily deaths is 1,300 per day. When I spoke with you last Friday, we covered CDC's recommendations and our decision to offer Pfizer vaccine booster doses to specific communities. For those who received a Pfizer primary series and who are at least 6 months after their second dose, the following Americans are eligible for a booster. Those over the age of 65, those 18 and older who have an underlying medical condition, such as asthma, diabetes, or obesity, and those 18 and older who live or work in a high-risk setting like a hospital, school, grocery store, long-term care facility, or a homeless shelter. Although protection against hospitalization and death remains quite high, we are starting to see these populations have some decreased protection against SARS-CoV-2 infection, likely due to both waning and to the Delta variant. Many of the people in these groups were some of the first people in the country to receive their vaccine. They also include people who, because of where they work or live, may have high rates of exposure to COVID-19. And they are the same people who remain essential to our current COVID-19 response, like healthcare workers and teachers, as well as those in frontline jobs. Their well-being is essential to keeping hospitals staffed, schools open, and many other essential parts of society functioning. Both FDA and CDC reviewed data on the safety of booster shots, including for those who are 18 to 64. Today, we're releasing a new publication in the MMWR that shows that COVID-19 vaccine booster doses so far are well tolerated. This report includes some of the data of our early experience with third doses that FDA and CDC reviewed when they made their recommendations about boosters. The frequency and type of side effects were similar to those seen after the second vaccine doses and were mostly mild or moderate and short-lived. If you are eligible for a vaccine booster and you have questions, I encourage you to go to vaccines.gov, talk with your healthcare provider, pharmacist, or a health professional about your current risk for COVID-19, the benefit of a vaccine booster dose, and the safety of receiving an additional dose. We will continue to evaluate data as it becomes available in real time and with urgency, and update our recommendations to make sure that all of those at risk have the protection they need. This includes those who received the Moderna and J&J vaccines as their primary vaccine, and also those younger Americans who are not currently eligible for a booster dose. As I said last week, this action is an initial step related to booster shots. It will not distract us from our most important focus, to get as many people as possible vaccinated with a primary series. We remain steadfast in our effort to vaccinate as many people as possible and to continue our fight against COVID-19. Those who are unvaccinated remain the most vulnerable to infection, severe disease, hospitalization, and currently there are over 70 million eligible Americans who remain unvaccinated. The best way to protect everyone, including those who are not yet eligible to be vaccinated, such as our children less than 12, is to vaccinate as many eligible people as possible. My closing ask to you is, if you have not been vaccinated, please do so. If your neighbor, family member, or friend has not yet been vaccinated, please assist in providing them the resources to get there. Thank you. I'll now turn things over to Dr. Fauci.
Thank you very much.